So what we used to do if we were suspicious of cancer, we'd do biopsies on the prostate. And this was unusual in the context of all other cancers because we have been unable, prior to the MRI, to take pictures, good pictures, of the prostate and image it accurately.
Urologists have been blind really for 20 or 30 years. We couldn't see cancer, and it's finally caught up with virtually every other cancer in the body because most other cancers you can see on some sort of scan, but prostate has been invisible.
So we used to do multiple biopsies and just see if we could hit a lesion in there. So it was pretty good at diagnosing big tumours in the peripheral zone, but it often missed smaller tumours, and it did not pick up tumours in the front part of the prostate. Also, because it was fairly random, you could underestimate the severity of the cancer. For example, it might show it was a very low-grade cancer, but right beside it was a high-grade cancer, and you didn't know because you were just sampling blindly.
There was about 26,000 prostate biopsies done in 2010, just give or take, in the private sector. Depending which studies you read, 50 to 70% of those men had no cancer found. And if you think that most of them would still be ultrasound, that means half of those 26,000 men are having a procedure that doesn't show any cancer, exposes them to risk, costs the health system money.
So what we have to do is try and discriminate which prostate cancers need treating and which prostate cancers don't need treating. And the MRI has been very helpful in this regard.
What we're looking at is a fairly typical example of a prostate cancer on MRI. These sorts of images are really we've only been able to achieve in the last couple of years with the advances in technology, and particularly the high-end MRI scanners that we have available at the Wesley. So on this image we can see an area that's relatively dark at the front edge of the prostate gland, and then we use other information that we glean, and we can see that that same area is looking relatively bright on this type of scan, which assesses the amount of cells in the area, and we know that cancers generally have more tightly packed cells, and we can see that that corresponding image goes fairly dark. So we've got a good concordance between all of those images. Using all of those combination of features, we've got a lesion that's very suspicious for cancer. We still need a biopsy to confirm a diagnosis of prostate cancer. What we think is one of the best ways to go ahead is to perform an MR-guided biopsy, where we put the patient back in the MRI scanner and using the MR to direct us straight to that area, we just put a couple of biopsy needles into that area and confirm the diagnosis.
You can see already on this middle image there's a large black lesion at the front of his prostate. You wouldn't be able to feel that when you felt his prostate. And when we do the ordinary ultrasound biopsies, most of the needles would actually fall short of where that lesion is. So he's the sort of patient exactly that we would have missed the diagnosis on in the ultrasound era.
We did an international trial here, which was published last year, and basically if you image the patient first and then just target the lesion, the following things happen. The first is that you cut down the number of men that need any biopsy at all by 50%. The second thing is that you reduce the diagnosis of the very low risk cancer or non-life-threatening cancer by 90%. So you don't find that, which is great because then people don't get unnecessary treatment. Thirdly, we increase the accuracy of the diagnosis compared to normal biopsies by around about 12%. And fourthly, the number of needles required to diagnose a particular prostate cancer fell by 90%.
Well, look, I think MR is really revolutionising how we diagnose prostate cancer. It means that a lot less men are being subjected to unnecessary biopsies. It also means that we're more likely to diagnose those cancers which are most significant.
This has been an Australian sort of success story in terms of what it's done in the health sphere, and I think the next step is to make this more broadly available to Australian men everywhere.
MRI of the prostate is a generational change. For the first time we've been able to actually see the organ we're dealing with, and it's great for the patients because a lot of them don't even need biopsies, and the ones that do need biopsies, you know where to go for these biopsies, and so it makes it much more accurate in planning management.